record. All right. So I'm going to just repeat something that I've already said to the ladies that are on Zoom that I hadn't pushed record yet. Wednesday at 10, I'd like to get together and do just a little ICD-10 tutorial, because sometimes you're going to see that they're asking for ICD-10 codes. I do not expect for you guys to know those. And so I'm not going to be grading ICD-10 codes. I'm only going to be grading CPT codes, modifiers, things that we've already been over, HICS, PICS, things of that nature. But if you want to try ICD-10 coding, I'm going to give you a little bit of information so that you can actually start practicing that if you'd like to. Okay? So CPT codes are what we did. ICD-10 codes are why we did it. So ICD-10 codes are diagnosis codes. Hospitals get paid the sicker you are, so those are ICD-10 codes. Doctors get paid for what they do to you, right? That's where they make their money, is what we're fixing to get into now, is the CPT codes. But if you just go in and you have a broken foot and they want to see you for observation in the hospital versus somebody that has COPDs, having open heart surgery, their diabetes is out of control, who are you going to get paid more for? The sicker patient, right? So that's all diagnosis based. Does that make any sense?
Mm-hmm.
Yes.
Okay, so we're going to go ahead and move into modifiers. What does a modifier do? What's it for? It gives the insurance company, our third-party payer is what we call them, it gives the third-party payer more information. This is the way I like to describe it. If your CPT codes are the names of your major highways, your modifiers are your street signs. So you know when you're on a trip and you're driving down the highway and you want to know what restaurant you want to eat at, and you see those signs that have all these little restaurants, that's what your modifier is. It's giving more information. That may be a silly analogy, but I'm a very visual person, and so you're going to find that sometimes I try to attach something visual to what we're doing. So a modifier is giving the third-party payer more information, extra information. I'm going to have my rotary cuff up here replaced. Can you just send to the insurance having a rotary cuff replaced? Well, there's two of them in there. They're going to know which one, right or left, unilateral or bilateral. So that's what they're going to want to know. So you're thinking, well, how do I know which one of those modifiers to use? When we get into CPT coding, there are lots of little notes underneath it, and it's going to tell you. So we call them parenthetical notes. You're going to get sick of that word. Did you read your parenthetical notes? There's notes everywhere that we have to read, and we have to look, and we have to research as part of our job. Okay, so where do we find a list of modifiers? My CPT manual probably looks different than your CPT manual, but basically it's the same information. So where are your modifiers found? On the back cover of your CPT. And then you have an appendix in the back that's full of modifiers, but we're just going to be using the back of our CPT. The very back of that front cover. You know, your CPT looks like this. Well, it doesn't look like this. Mine looks like this. But if you turn it over, and on the very back, you have your symbols and you have your modifiers. You have all kinds of information there. So when you open up your CPT manual, what does the back of your front cover look like? Show me, Lariana. Do you have yours? Looks pretty similar, right?
Yeah.
Similar. Okay, so that's where I want y'all to be right now. Go ahead and open that up. And the queen of the slideshow is going to do a slideshow for you, but it's going to be fun. Y'all, it just keeps my brain on track. I need to have that list of what I'm going to talk about. So I'm going to go ahead and share my screen. And today we're just going to be talking about 3 of the most commonly used modifiers. We're going to talk about 25, which is significant, separately identifiable evaluation and management service. by the same physician or other qualified healthcare professional on the same day of the procedure or other service. 25 is almost always used in evaluation and management. So 25, I'm not going to tell you every single time you use a 25, it's going to be an evaluation and management, but I'm going to say 99% of the time, 25 is only used in evaluation and management. 26 is professional component, and 59 is distinct procedural service. Now, I'm going to give you some examples. We're going to look at some clinical scenarios. So here is an example of the appropriate use of modifier 25. A patient visits the cardiologist for an appointment, complaining of occasional chest discomfort during exercise. The patient has a history of hypertension and high cholesterol. After the physician completes the office visit, it is determined that the patient needs a cardiovascular stress test that is performed that day by the same physician.
Same, yeah.
It's performed probably that day, and if the cardiologist has the equipment, it's performed at the office. So it's going to be performed that day by the same physician. So let's just slip on down to, you see coding example 99214, 25. Well, that 99214 is an example of an evaluation and management code. So if you were going to code this, you would say 99214, that's the office visit. And then that 25 modifier goes beside it because because we're going to use a 93015, which is our stress test. So why do you think we need that 25 modifier?
Because it's the same day.
It's the same day, but it's telling our third-party payer. Mr. James came in, we saw him, it's a 99214. But hang on, this is where your 25 is your hang on. We did something else. We did a cardiovascular stress test.
Okay.
Because if you just did the visit and the stress test and it's mushed together, they're just going to pay you for the first code they see. That modifier tells them, hang on a minute, you need to pay us for two things. So what are they going to pay them for? They're going to pay them for the office visit, and they're going to pay them for that stress test, correct?
Yeah.
Is that understandable?
Yeah.
Okay. So we're going to move on to example of when to use a 26 modifier. 26 modifier says professional component, right? A pregnant patient presents to the ER with premature contractions. The ultrasound is performed in the hospital. It detects abnormalities in the pregnancy. The patient is referred to a specialist for a follow-up. And the hospital imaging report is sent with the patient for further review. The specialist reviews and interprets the ER ultrasound. So the specialist would use a 26 modifier on the ultrasound CPT to represent their interpretation only service of the report. Okay, that was a lot of words, right?
Yes.
26 is used with radiology. What did she had? She had an ultrasound, right?
Yeah.
So Miss Pregnant goes into the ER. She has her ultrasound. They think she needs to see a specialist. They give her, or they send over the ultrasound. That specialist reviews that ultrasound, and then he looks at it and he says, oh, I think this is wrong, and this is wrong. He does what they call interprets it. We use the 26 modifier to tell the insurance company, the third-party payer, that all he did was the interpretation. All he did was took out the information from the ultrasound that the hospital sent over. So let me see. I'm going to look at y'all. I want to stop my share for a second because I want to look at y'all when I tell you this. Okay. The ER is going to bill for that ultrasound. But that's all they get. They get just because they took the ultrasound. Our specialist interpreted the information, right? He only gets paid for the interpretation. Let me ask you a question. She's in the ER. They do the ultrasound and they interpret the ultrasound in the ER. The ER gets paid for all of it, right?
Mm-hmm.
Because one doctor did everything.
Right.
Okay.
I know it sounds complicated. I promise you it's not. When we start coding and you get to see the whole story, it's going to make more sense. But we're just kind of talking about what these mean. The most popular ones mean, okay? 26 goes with radiology 98% of the time. 25 goes to where 98% of the time?
Evaluation and management.
Evaluation and management. So I'm showing you some modifiers, and when we get into those sections, I'll remind you of those modifiers again, okay? But the 26 says, all I did was read the information. I didn't actually take any of the pictures. Okay? Makes sense? All right, I'm going to go back. I'm going to show you one more modifier. So we're going to talk about when to use the modifier 59. The 59 modifier is one of the most misused modifiers. The most common reason it should be used is to indicate that 2 or more procedures were performed at the same visit, but on 2 different sites. Do y'all see that? So I'm going to the orthopedic doctor. I need to have my finger and my toe looked at. We're going to do 2 different procedures. The modifier 59 tells the third-party payer, same doctor, same patient, 2 different procedures were performed, but on different body types. We're going to do some examples, so it's going to make some more sense. Just hang on. So let's look at an example of modifier 59. A patient presents to the emergency department with multiple lacerations in a motor vehicle accident. The emergency department physician performs an intermediate repair of a 2.5 centimeter laceration on the right arm, and then he calls a general surgeon for a consult for a more extensive laceration on the left leg. The surgeon performs a repair. These 2 services would be coded and billed out with the modifier 59. Your 1032 for the 2.5. No, I'm sorry. The 12032 is for the 7 centimeter laceration. The higher the number, the bigger the laceration. So that's how I know that. 12032 is for the 7 centimeter laceration, and the 12031 is for the smaller laceration. The reason that I'm putting the 59 on the CPT code is because, I'm sorry, I'm reading it again. It's because it's the same patient, same day, different body sites. Okay, so I know that that's a lot of information. I just want you to go with it for me for right now. We're going to do some more practice on these modifiers, but this is another one that's used very often. So now is when you're going to use your CPT manuals, because all you're going to do is look at your modifiers, okay? So increased procedural service, which modifier is that?
22.
I'm going to tell you,
Yeah.
but everybody
22.
agree?
Yeah.
Yes, ma'am.
22. I'm just warming y'all up. Anesthesia by a surgeon. Which one of these is that modifier?
47.
47.
Let's see. 47.
Yeah.
See, I told you I was just warming you up, right? So let's look at the scenario. It's an evaluation and management service was performed on an established patient in which the decision to perform a major surgery was scheduled.
That's 57.
or surgery.
57.
Patient was canceled for
57.
15 minutes regarding treatment options, risks, and projected outcome. Which of the following modifiers would be amended to the service performed?
D.
Yeah.
57. That's right, because we made a major decision, right?
Yeah.
57. When a patient is in a post-operative period and returns to the operating room for an unrelated procedure by the same physician, the following modifiers would you attach to the procedure being performed?
B.
24. B.
24.
Y'all think 24? What does 24 say?
I think
Okay, look at number 24. 24 says evaluation and management. Where are we?
79. It's 79.
We're in a
Unrelated
post-operative period. So we think 79?
Yes. Oh. 78.
78?
It's actually 79. It's a typo.
Oh.
Oh.
I was trying to trick y'all. Yeah, that's it. I'll have to. The answer is 79. Sorry. Okay. When two surgeons work together as primary surgeons performing distinct parts of a single reportable procedure, each surgeon should report her distinct operative work by adding which of the following modifiers?
59.
Oh, well.
62. 52.
How many surgeons do we have? Whoever said 59. How many surgeons do we have?
2. So it's 62, right? 2 surgeons.
62. 2 surgeons.
Oh, yeah, I see it.
How did you do? Did pretty good.
Good.
Huh?
Yeah.
Okay. That was just a little tidbit of how we use modifiers. You're going to get lots and lots of practice. Now, let me ask you an important question. What happens if you need a modifier and you don't amend it on your CPT code and your biller bills it out?
Wait, could you repeat that?
Yeah. Say that you're coding and you need a modifier, but you don't amend the modifier. So when your biller bills it out, she doesn't put a modifier on the CPT code. What happens?
They don't get paid for it, right?
A couple of things can happen. You could get paid less money for a procedure that you should have gotten paid more money on. Which, do you think that get noticed a lot? It doesn't get noticed a lot unless it happens over and over and over again. And then your physician, those physicians know in their head, they got a tally, y'all. They're saying, I should get $1,000 for this, and $500 for that, and $700 for that. The second thing that can happen is the insurance company can send you a claim back saying it's denied because there's no modifier. Okay?
Is that like a penalty charge for that?
No.
No, okay.
No, they do not get charged for that. That's just part of it. Sometimes you amend the right modifier and they send it back. And then you have to, and they say it's the wrong modifier, and you know as the coder it's the right modifier, and you have to call and say, how long you been coding? Well, they never coded. And then you have to send additional information to one. But, you know, modifiers take practice, and you're going to get plenty of practice. And I do want to, hang on, I'm running out of time. I always run out of time. Anyway, when you get to your facilities and you're in a specialty, they're going to have cheat sheets for you that's going to tell you this goes with this and this modifier goes with that. We're cold coding everything. What I want you to understand is if you have a situation and you think you need a modifier, but there's not a modifier on the cheat sheet or what have you, you're going to have that mindset. I'm going to tell you a quick story, and then I'll take a couple of questions. I have a young lady that works in Gina Memorial Hospital right now. She works in verifications, but the coders are beside her. Well, we have some older coders, and as a coder, it doesn't matter how old you get, I want you to always say, there's always something changing. There's always a way I need to learn. Always be looking for a way to make your doctors extra money. Just research, make sure you're up to date on all the new coding trends. But they were talking back and forth about this scenario, and my student was able to say, you need a modifier, blah, blah, blah. They were like, no, that we've never coded it with that. And she was like, well, there may be a change. And I'd be darned if there wasn't a change. And she was able to get that claim paid only because she was flexible in her thinking. We always have to think outside the box. We always have to be flexible in our thinking. Okay, so do we have any questions?
Oh,
No? Did you guys enjoy Zoom class?
Yes.
yes, ma'am, as always.
Well, I'm so glad. Now, I want you to know I'm going to be sticking this Zoom call into our assignment, daily assignment number 11. There's also another little Zoom lecture in there that has some different slides and some things. So it's going to be important to watch that too. In lab today, you have a little worksheet. I did some verbal instructions and kind of went through some of that with you on that too. I do want to also say on Thursday, you're going to get your very first experience with the Queen of Guidelines. It's long, but I'm telling you, if you will watch the Queen of Guidelines on YouTube, she breaks the CPT down like nobody's business.
Yes.
And I'm going to tell you what, it's long. If it's an hour, break it up, watch 10 minutes at a time. But I'm going to tell you something, guys. She is amazing. Get on YouTube, Queen of Guidelines, anything that you can find, gobble it up. She will teach you some stuff that she teaches me all the time. One of these days, I'm going to be a Queen of Guidelines. Today is not that day. I'm pretty good at them, but she just is amazing. All right. Well, I hope to see you guys on Wednesday. We're going to do just a little crash course in ICD-10 coding, just for general knowledge, to see if maybe I can help you with some of the questions in case you want to try the ICD-10 coding. But remember, if you see ICD-10 coding on a worksheet, an assignment, I'm not holding you responsible for that. So you can try it, but I'm not going to grade it until we wrap back around, and then you'll get plenty of practice then. Okay. Have a great day. Let me know if you need anything. Watch your emails. I'm going to be sending out study groups today.
Okay, thank you.
Bye, everybody.
Bye.
Bye.